So you do so much with pro athletes amongst others now, and to improve their performance through the means of like dietary and lifestyle interventions. And for the layperson, it makes sense, right? Um, Eating better, doing the right things for your nutrition, it's going to ultimately dictate how well our performance is and our quality of life. But it seems like there continues to be like a growing body of information that is showing that not only does it have an impact on performance, but also in mental clarity, GI disruptions, and perhaps even brain health. So I kind of wanted to start, when did you notice that an athlete's gut health is leading to disruptions in their performance?
To be honest with you, it really started with me. I feel like I'm kind of been the guinea pig, and the way just the whole thing manifested is really interesting. A couple years ago, I did this 52-mile like run, and it was for like I wanted to join my friend, and I wanted to, I wanted to support him. We were raising money for a really, really good cause for sex trafficking. And, that year was also COVID. So I was, lifting a lot, I was training a lot. And then I did this, run. I noticed that a lot of, I was starting to have like a lot of symptoms, a lot of, joint symptoms, and I wasn't able to, recover. No matter how much cryotherapy I did, or how much sauna, or how much I rolled, I just had this thing where there was something that was wrong. During that time, I was also, of course, during COVID, like a lot of people, they're like, okay, really questioning their career, really questioning, where they want to go. And at the time, I was applying to go into family medicine as a nurse practitioner, and do and work in the clinic. And I crossed paths with my mentor, Dr. Ara Supaya, who works with PGA athletes right now, and took his master class. And my mind completely, I was just like, oh my gosh, this is me. Um, he talked about the inflammation in athletes, and how this is a really, really big concern, as far as what's really dismissed with their team doctor, and more going towards a functional medicine aspect. Because a lot of team doctors, they'll draw blood, but we look at stool samples, we look at urine samples, and we can get a lot more data just by doing that. And I'm like, you know what, I'm going to test myself. And I got my labs, and I was completely blown away. Inflammation, I had yeast growing in my gut. I had there was a marker for my immune system that was low. And I would have never thought that I could get this from just a blood test.
Yeah.
This was all just from my poop. So it totally, it blew my mind. I'm thinking, why isn't anybody doing this, in, Dr. R is doing this in golf. No one's doing this in the NBA. No one's doing this really in NFL. And once I got into this space, I actually now am friends with two colleagues who've actually been doing this in the NBA with the Washington Wizards for 20 something years.
Mm.
And also, there's another doctor who's also working with the military, that is also testing. And talk about athleticism in the military is beyond what we see, on the court and on the field. And so it's a very small, so I just know those two people. It's a very, very small niche. Not many people are really getting into this, because there's a lot of confusion how the gut is really related to our entity, our health.
Well, one thing that you mentioned is the functional status and some of the work that you've posted before. And I suppose when you're looking and collecting all of this data, what do you mean by like the functional status of either you or the athletes that you're looking at?
So what I mean by functional, there's a sect of medicine called functional medicine. And my mentor term, or he coined the term functional sports medicine, meaning looking at the human body as a functional whole, as a functional aspect, that nothing is separate when you're injured. Nothing is separate when you're healing. You know, your cardiovascular system is tied to your endocrine system, your hormones, it's tied to your, you know, your gut, it's tied to your brain. And you know, when you go to the doctor, we have a, you know, we have a cardiologist, and we have a gastroenterologist, and we go to our family medicine, and we this. So basically what I do is I look at the athlete as a whole, and I'm like, no, this needs to be, the whole thing needs to be assessed, because we can't just take this one person that's running on this high altitude engine and say, hey, you're going to go to this doctor for this marker, and you're going to go to this doctor for this marker, and you're going to go to this neuro doctor for your brain, for your concussion. And yeah, it's incredible.
Was that idea foreign to you? Was that something that popped up into your mind more recently after you took the masterclass and been working with athletes, or was it something that you learned in school and you were kind of just, you knew about, or was it completely foreign and now it's like this whole thing that you're really getting into?
So Mike, it's funny that you asked that, because I've always been the person when I was doing my clinicals and when I was doing my my program in family medicine, is I've always been the one that was like, that doesn't sound right to me. You know, I've always been the one that's questioned things. I've always been the one that, you know, during that time, I listened to a lot of podcasts, a lot of people in the functional medicine space, you know, Dr. Mark Hyman, a lot of people that have made really big impact in people's health, outside of, you know, the pro athlete world, you know, people like you and I. And I'm like, you know, why aren't we talking about sleep? Why aren't we talking about, you know, nutrition? And as you know, in our program, we didn't get any like nutrition advice. We weren't taught any of this stuff. And it's really the most important thing.
Well, hopefully, as more information comes out about it and people are doing things in pro sports and more functional medicine type doctors perhaps are coming about, it'll perhaps be integrated more within the curriculum, because it seems like people on the outside really have to do it and experiment, and then the body of evidence, or at least the body of people who are in education, catch up, and then they make it like commonplace. But it's not necessarily what you saw when you're going through school, nor myself.
Yeah. And I mean, you know, I'll be honest with you, there's a really, really big frustration on my part, where you see a lot of, you know, teams, you see a lot of people that are investing in, okay, you know, it's got to be more strength, it's got to be more conditioning, it's got to be more, you know, recovery, it's got to be more this, got to be more that. And we're not getting really to the root cause of inflammation that they're having, that they absolutely don't even know. So whenever, you know, whenever I was hearing a lot about, you know, the non-contact sports injuries that was going on in the NFL in the beginning of the season this past year, I'm like, man, what is going on with their gut? Like, I would just like, you know, I'm like a detective. Like, I just want to, you know, take their stool sample, and I want to know like what's growing in there, man. Like, we need to know what's going on. So it's a really, really big, it's really fascinating, and it's something that I feel like it's going to be emerging, honestly, within the next 5 years.
And it's all of it too, right? It's not just, you know, you make an important point where they're focusing on strength and conditioning and recovery, and those are important too. But also it's like, well, there's also this other elephant in the room that we perhaps aren't looking at, or at least acknowledging, and could perhaps make a huge change to the way that people are living their lives and the way that they're feeling. Because I know for myself, there's certain things, especially as I get older, I'm learning, like, oh, I can't eat that anymore. There's things that perhaps I need to think about in regards to like how I need to plan a meal if I'm going to be doing something where I'm planning a big lift or doing whatever. And I can imagine if you're performing at a high level week in and week out, that becomes more and more important.
I mean, Mike, can you just imagine if we do this with one athlete, right? if we can just collectively, just honestly come together and have a 360 approach, ATs, PTs, coaches, functional practitioners like everybody just come together and be like, how can we make this one athlete the best that they could be, from the inside, starting from a cellular level to a physical level, which is what you do as a physical therapist, right? And just have that collective 360 model. And so that's what I love about what I do, is that I'm able to, do the testing at a cellular level, and then have people that I absolutely adore and love in the space, physical therapy space, or, corrective manual therapy, or whatever it is, have my people. And I'm like, hey, you need to go over there. You need to do the extra. Mm-hmm. And that's the thing with being, especially when you're dealing with an injury or being a pro athlete, you have to go out there and you have to do the research and you have to do the extra. It's not just doing what your teammates are doing, in the recovery room. It's about going outside and really advocating for yourself and be like, you know what? I need a little bit more than what is prescribed to me.
Yeah, I'm certainly excited for the future as well. And I think the approach to individual, or at least the approach to looking at the individual, is becoming more and more commonplace. We have to look at the one person in front of us rather than the collective whole. And I think that's where we're going to see some of the biggest differences. And that's where again, for me, when I'm looking at perhaps a patient with low back pain or knee pain, I try to look at all the contextual factors and try to bring them all in together to be like, how is this patient going to succeed? And what am I going to need to do in order for them to be better, versus just like, this is just another knee patient. This is just another low back patient. But let's get into some of the indicators, at least like what you're looking for. Like, what are some physical symptoms that you may have, or things that you look for in your athletes that may indicate that someone's having a gut health issue?
So I think really just the obvious reasons that really get overlooked is something like they're not able to recover as fast as that they would like, right?
So what is that? What is like recover? Like, what are your markers for recovery? Are they sore all the time? Are they really, really tired? I suppose just dive into that a little bit more.
So fatigue, or having to take an anti-inflammatory just to get by. We can have 1 hour podcast just on why anti-inflammatories, taking it for a long period of time, especially more than 10 days, it's horrible for the body. Like, they need to actually put that where we need to start prescribing anti-inflammatories. I mean, that's how dangerous they are. And so, the common symptoms would be things like fatigue, or not having good, brain clarity, or maybe just not as fast as if they would want to be, or bloating, or diarrhea, or constipation, or things like just a joint pain. They go to sleep tired, they wake up tired. So there's just a lot of those things, and I have them fill out a very detailed assessment about, every single little thing. And that way, that's what my job is to be that detective, to come in and pinpoint and be like, well, this goes with this. Well, I can see why you're fatigued. It may not be that you need more 2 hours of sleep, right? It may be that there is inflammation going on with you at a cellular level that we need to treat and we need to heal.
Right. And it's not like, if you're given a hammer, every solutions, or if you have a hammer, not every solution to the nail is going to be the hammer. Right. So I'm assuming that a lot of the time, well, maybe I should ask it like this. Have you had somebody where you've analyzed them and perhaps everything comes back normal, and they maybe need to go see somebody else, or there's something else that they need to do? Maybe they're working too hard. Are you constantly communicating with other providers to perhaps help the person in front of you?
So as far as other providers go, like I said, I mean, there are where I would say, hey, you need a little bit more PT than what you're doing right now, or hey, you need more manual corrective therapy. And there's an amazing, guy that I've known for years that has worked with Kobe Bryant. I'm like, you need to see him. You need to get worked on. As far as, diagnosis wise, I have never come to a point where I'm like, I'm not sure what this is and I can't help you.
Mm.
A lot of times I'm able to help them. What I see in my pro athletes that's very interesting, Mike, when it comes to doing the gut testing, is they have a lot of something called small intestinal bacterial overgrowth. And obviously, the main thing with that comes from processed foods, not having enough fiber. And the problem with that, as an athlete, you're not able to digest your protein. So imagine you're an athlete and you're taking in this protein and you've got an intestinal bacterial overgrowth going on, and you're not even able to absorb your protein.
Wait, so you mean to tell me that pro athletes don't have a good diet?
I mean, that's not news to us, right?
Yeah.
Yeah. Yeah. And then there's also some other things some habits that I tend to see also. They're drinking from a lot of, plastic bottles that can also damage cellular health and mitochondrial health. I know I haven't really talked about the mitochondria. I don't want to. It's a very niche topic as well. So those are the two things that I like to test for, is the gut and mitochondrial health. And so, habits like, hey, we need to start switching from plastic bottles to now steel, bottles, if you could start doing that. So little things like that are over time really does make a difference.
Now, is this something that people develop and this is just who they are as an athlete, or are they developing it perhaps over time because of their bad diet, right? Are they born with these like perhaps barriers to intake of protein, or is it just something, a byproduct of their habits and the things that they do day to day?
I mean, it's very dynamic, and what I mean by that is there's a lot of reasons for that. So with pro athletes, they're obviously overtrained. I mean, they're overworked, they're overtrained, they're not sleeping well based on their schedules and everything. Depending what sport you play, I would say maybe the NBA would probably be the worst out of all of them. But there are stressors that really creates a lot of havoc on your immune system.
Mm.
And so where do I always say, okay, 80% of your immune system lies in your gut, right? So what's the first thing that's going to be upregulated whenever you're under a lot of stress? It's going to be your immune system. So where is it that it's going to be affected the most? Well, it's going to be in your gut, right? So I feel like it is a very important approach to see things as like, well, it's not something that they're born with necessarily. This is something that they've over time, because of having to train and get to where they're at, there's been a lot of stressors that have come their way. And then also having really bad habits, nutritional habits that have compounded over time for them to have gotten where they're at.
So there's like an established norm that a lot of at least you're going off from, to say that there's something abnormal here. And because of life factors, whether it be sleep, stress, etc., you're saying, hey, you're not within these parameters in which you need to be in order for you to perform at your best. And because of that, we need to take a closer look and look at your blood, look at your stool or whatever. And then based on the information, you're making a change to their diet and saying, let's do this, let's do that. And then we'll reassess, right?
Right. Yeah.
And how often are you reassessing athletes, so to speak, when they come in and they're at a loss for words, they don't understand what's going on, I suppose. What does the first test look like, and what is the frequency of follow-up?
So in the beginning, it could be a little overwhelming, because I draw blood. I test for a lot of blood biomarkers, more than what team physicians would test for, because I've seen the tests that team physicians have tested for. And based on that, on those markers, so say, for example, I think the easiest thing would be the vitamin D level, right? So if their vitamin D level is not in an optimal range, then I would, test it for, after 3 months. I'd be like, you know what, this is something that we need to be on top of. But no, I only get tested, once in the season. I'm like, yeah, but that's why you're coming to me, because we're wanting to optimize you. We're wanting to get you to a place where, you're at the top and performing at the top. And so we need to take a different approach and really just be on top of this. So, and then as far as, things like cellular, mitochondrial health or gut health, again, it just depends. Am I treating for bacterial overgrowth? Am I treating for yeast overgrowth? Is there an infection going on? So just depending on that, it can be anywhere from 3 to 6 months.
So most of these issues relating to poor performance, not recovering enough, it's all related to bacteria. Am I correct in saying that?
I would say that's a really big factor, because if your immune system most of your immune system lies in your gut, it's your immune system that is responsible, your cells that are responsible for that healing. So you can get the best PT ever, but if there's something else on a cellular level, inflammation that is going on, that is not, that is overlooked, or if there's nutritional deficiencies that are overlooked, then that can set you up for another potential injury. And so there are a lot of data when we're talking about things like, osteoarthritis, or, knee, arthritis, or a lot of neuromuscular diseases out there that are so much tied to the gut health.
And so with this bacteria, they're leading to perhaps physical symptoms, right? And so those physical symptoms can often be gas and bloating and amongst other things. And is it because this disruption in bacteria, perhaps not enough, or the wrong bacteria, that's what results in physical symptoms and GI distress?
Absolutely. People that have had concussions have a higher chance of gut dysbiosis, which means their gut also gets inflamed as well. And so that is overlooked. So we hear about the gut-brain connection as well.
And we also hear this term like leaky gut, I suppose. Is that a part of like everything we've been talking about? Or I suppose for people who don't understand what that is, can you describe what that is?
Yeah. So basically we have a lining in our intestine, right? And there's, not to bore you with the science, but that lining is so incredibly important that it's intact. Okay. So if this lining is not intact and there's holes in the lining, what happens is that you're going to have undigested food going through there. You're going to have, maybe if you're on, an anti-inflammatory, that's going to go through there. You're going to have some gluten substances, and we know that's highly inflammatory, gluten products. And that's just going to go through the gut, and you're going to start having an immune response. Your body's going to be like, wait a minute, what is this? We need to turn on our, cytokines. We need to turn on the immune system, and we need to start attacking. And so that's how that snowballs into, okay, what are we going to attack? Are we going to attack the muscles? Are we going to attack the joints? Are we going to attack the brain? Are we going to create a bacteria? And so that is what I see from the tests, is when there is leaky gut, what is going on within the body that is inflamed.
I just want to clarify. So when perhaps not incorrect meals, but perhaps bad foods going through the system, because there's such a link between the gut and the immune system, the body recognizes this entity as foreign and says, I don't know what's going on here. We're going to send a bunch of inflammation down to try and break up what's going on, so that way we can figure it out. And then from there, because the immune system's controlled by everything in our body, inflammation can go to various points in the body, and it could be presented as many different types of symptoms as what you're describing, correct?
Absolutely.
And I'm assuming that when people are coming to you, you get, it can be literally anything in that regard, then, like their sleep disturbance, their joint hurts or something like that. And you kind of have to play this whole detective role, figuring out like what's actually going on here. We need to get to the bottom of what's
Yeah.
causing your issue.
Yeah. And don't get me wrong, there are some issues that, that need, things like PRP injections, or, you may need surgery. So I'm not saying that, hey, this is, if you have an injury, this is all from gut bacteria. This is not
Right.
what this is about. My lane, which is what I like to stay in, my lane is about inflammation in the body. Where is the inflammation in the body, right? How can I help you perform better? How can I have you also heal more optimally? Because definitely no one wants holes in their gut. No one wants things, nasty digested food going through their colon. So and that stuff, there's a bacteria that's very powerful. It's called LPS bacteria. And that bacteria is so powerful, Mike, that it can actually go through your blood-brain barrier and go to your brain. And so that's when we start seeing a lot of neurocognitive symptoms and things right now that psychiatrists and psychologists are now looking at is something called the neuropsychoimmunology. Because now they're tying a lot of depression into the gut health as well. So that's huge.
So because you're eating perhaps poor food, and this is all speculation, I am no neuroscientist, but in any event, because you're having these poor foods, it produces this bacteria. And because this bacteria has the ability to go through the blood-brain barrier, which is basically a layer that filters out bad things from getting into your brain, very layman's terms. But because it can go through that, it can then alter your ability for your brain to function. And I guess, what are some of those symptoms? What does that look like?
So some of those symptoms could be brain fog, depression, just not being inability to concentrate, right? Lightheadedness, with concussion, if you're having prolonged concussion symptoms, that's also one of the biggest things. There's a colleague of mine that his specialty is concussions, and that's one of the things that he does is he tests for gut health as well, and make sure that their gut health is in check, to make sure that whenever he is treating them through the concussion, that at least if they have that part dealt with.
So how hard is it for you to change some of their behaviors? I mean, some of these pro athletes, they've been doing everything right for so long, and then you come along and be like, listen, we're gonna have to, the Cheetos are gonna have to go. So I suppose have you met some resistance?
Hot Cheetos. I used to be addicted to that when I was like, I don't know, I think in the 6th, 7th grade.
Yeah. I think everybody had a Cheetos kick at one point in their life, right?
Not just regular Cheetos. It's got to be the hot Cheetos.
It's got to be the hot Cheetos. Got
it. Yeah. It's hard. I'm going to be honest with you. This is not easy. Like, and I have to remind him, like, listen, I'm not your mama. Okay. So I am not going to constantly remind you of this. I do want you to know that if you come to me and then if you want results, then you're going to have to take some direction. You're going to have to let go of some of this control and some of this ego and be able to do those things on your timing. Same thing with PT. If you're not doing the exercises, you're not going to see results. And then what are you going to say? Well, Mike, I've been working with Mike, but I haven't been seeing any results. So that's not fair to us practitioners. You've got to do the work. You've got to take the protocol really, really seriously, and you have to do the work outside. Have that Mamba mentality.
It's certainly tough, even like trying to get someone to do one exercise. It's like, listen, you're in pain. I'm trying to show you the solution here. I'm laying the path out to the promised land, and you're still like, I don't know. I only did it once this week. I'm like, oh God, what can I do?
Right.
Yeah.
No, and that's the thing. Hey, you have a PCL tear that can progress. Do you want it to progress? Do you want to play an extra year? Do you want to play an extra 2 years? Like, that's really up to you. I mean, it really is. So you've taking those things really seriously and doing the what I call it, like, not so sexy stuff, right? doing the really small things every single day really compound and make a big difference.
And you mentioned PCL for like maybe a partial tear or something, but how have you seen this translate to performance on the field? I mean, you're working with these pro athletes and you intervene with their diet and their nutrition, and maybe what is some maybe anecdotal or at least subjective evidence that you've seen people coming back to you saying like I've been performing better, I've been doing X, Y, and Z. What have you seen?
I mean, subjective wise would be, uh, I would say that, yeah, that I'm feeling better. I'm not, it's not as inflamed as it used to be. There's not much, they use the word water. It's not as, there's not much water, around my knee as much. So it's a really cool deal, but I know that it's not just me. It's a collective thing. It's going to your PT, it's going to your manual therapist, it's eating the right foods. It's, if you have an infection, we're working on that infection as well. So it's a 360 approach.
So someone who is not a professional athlete may not have all the resources to someone like yourself, but they're curious. They maybe have inflammation in their knee or swelling in a joint that they maybe want to get looked at, but they've been to other providers and they're just not, they feel like they're not listening or they've tried everything that hasn't worked. How does someone go about maybe figuring out if they have a leaky gut and like getting the steps started to understanding their own body?
Yeah. So I would say definitely look at the ifm.org. So that's the Institute of Functional Medicine. And you can go on there and look for functional medicine specialists that do this type of testing as well. It's great. So you'll just, put your state in and you'll be able to look and see where, who the nearest functional medicine doctor is.
And do you need a doctor's prescription to do this, or can you just get blood work on your own?
No, you could actually go, well, as far as the blood work nowadays, there's all these companies right now that offer, okay, here's this kit and we're going to do, blood work. I don't want to mention who it is. I personally have a problem with that because you're now doing blood work on your own and you don't know what to do with it. And even though it says normal, but what is normal? They just have you in this range, right? And not even taking into account really true deep history and taking in those, like I said in the beginning, that assessment with your doctor or your nurse practitioner, because a lot of it is not just looking at labs. I mean, I'm also, feeling their thyroid, your heart and your lungs. So I don't want people to think that they can just go get this kit and it's all good. But to answer your question from the beginning, yes, you could go to a functional doctor. They can get the blood work there. They can get their stool test there, see what inflammation is going on, and create a protocol, to get them towards their body doing a process of healing.
And of course, getting guidance from somebody who knows what they're talking about is always helpful, but perhaps even more helpful is at least giving somebody some tools to help with them to understand their body. And
right.
If they go and get the blood work, they got this piece of paper looking up all these foreign numbers and these ranges. Some things may say normal, some things may say low or high. Right. What are biomarkers or markers that you particularly look at that may indicate that you need to go and get somebody's help to try and walk you through this process of understanding your body a little bit more? Are there, you had mentioned vitamin D earlier. So I was wondering if there's a few that you're like, if this is low or you're, bad here, you definitely need to reach out to somebody to help you.
Yeah. So a number one thing is CRP and HSCRP. So I would do, HSCRP, I would do a GGT level to see how you're detoxifying, uric acid level, hemoglobin A1C. I definitely want to see last 3 months what your glucose has been like. Is there sugar coating that red blood cell, right? And so taking your glucose level doesn't look at the last 3 months. So with the hemoglobin A1C, we're able to look at that, and we hear about insulin sensitivity. So that's a really big deal when we're talking about inflammation. The other things are things like homocysteine levels, so just a CBC, CMP, looking at hormone markers as well. So yeah, a lot of those.
And perhaps are there foods that you're finding? I mean, you mentioned plastics before, and you're mentioning amongst other things, but are you noticing there's certain foods that perhaps people are having problems with, whether it's yourself or athletes?
So I heard this one coach that said something really cool, and it always stuck in my head. Well, I heard two things. Well, this is what he said first. So the first thing is if you can't catch it, and if you can't pick it, and if you can't plant it, then don't eat it.
Hmm.
I always thought that was cool. I was like, okay, right?
Yeah.
It's simple, like, okay, hunter gatherers. So, you're a hunter gatherer. We are hunter gatherers. So, what would a hunter gatherer, eat, right? And then anything, and then the other thing I've heard one time is anything that is uh, inside of a grocery store should be avoided.
Oh, so like the inner workings of
Like
it, not like, yeah.
working up the grocery store, you should most likely avoid that. But when I go to Trader Joe's, I get in a lot of trouble.
I think everybody kind of runs into trouble there.
Oh my gosh. Yeah. Yeah. I mean, for me, it's so funny because of my kids are like, why did you buy that healthy snack?
Just be like, you'll thank me later. Don't worry about it.
Yeah. No, that's not what my 7-year-old said.
well, well, other than lifestyle interventions and perhaps the food that you're eating, are there supplements or things that you can take to help improve your gut health?
So, I mean, obviously, the most obvious thing would be probiotic, right? Like there's this, but this is the thing with probiotic, Mike, is taking a probiotic. And if you've got intestinal bacterial overgrowth, you do not want to take a probiotic. You want to be treated for that first before you sit here and throw antibiotics.
Why is that?
Because you are actually, so think about it, there's an army of bacteria in your gut, right? Okay, so when you're taking a probiotic, that's an army of bacteria too. So if you have an overgrowth, you're just adding more armies. And so we're trying to treat and balance those armies because you don't want to get too much.
Mm.
Right? Because then you start having malabsorption, maldigestion problems, right? And so we need you to absorb nutrients. We need for you to absorb the vitamins and minerals that you're taking in. And so you definitely don't want that. But I would say look at foods that are, prebiotic, things like, onions and things like pomegranates and cherries and things that are very rich in polyphenols, because what that in fiber, because what that does is it feeds something in your gut called short chain fatty acids. And what those short chain fatty acids do whenever you eat them, they get fermented and it gets converted as energy. So if you want peak performance and if you want energy, you want to make sure that you have enough of those short chain fatty acids.
Now, much like taking a probiotic, when you have perhaps a buildup of bacteria, too much of a good thing is not necessarily good. Is there ability to take in like too much fiber? I know for myself, if I've eaten too much like brown rice or amongst other things, sometimes my stomach becomes irritated, and so I try to stick to more simple sugars like white rice and just less complicated sugars. So I suppose is much like taking a probiotic. If you have a gut health issue, is eating too much fiber could that also lead to GI distress?
It does if you have a bacterial overgrowth. So it makes me wonder about you, Mike.
Yeah, I mean, I guess I gotta have to figure that out.
Yeah, I mean, that's what I also ask is like, hey, when you eat this, do you feel kind of funky? And then a lot of times, like, yeah, I start feeling bloated and stuff like that. I'm like, okay, that's kind of a red flag right there.
And does the complexity of the food matter in regards to how much you're eating? I mean, if you eat too much So you're saying that even though if you eat a lot of fiber, because if there's a GI distress issue, you're going to have symptoms. But if your GI was running like a functioning machine and it was running the way that it was supposed to, then you shouldn't have any issue with it.
You shouldn't have any issue unless there are things that you're sensitive to, which another panel that I run is a food sensitivity test. So if you do have sensitivity, it is because there are the integrity, the lining of your gut. There's something going on with that. That's why I always go back to the basics.
Right. And
right? Well, I'm sensitive to this. Well, it's like, why are you sensitive to this? Let's see what's going on.
And so supplement wise, you more promote just going back to good foods rather than trying to take a pill to figure out the solution.
Yeah, I always go to food first. The second thing that I would definitely do is, for God's sakes, take a multivitamin, a really good multivitamin, multimineral. Thorne makes a really, really good one. I love Thorne because, and this is not, I'm not a Thorne ambassador, by the way.
Not a sponsored ad.
What I like about them is they're clean products. And a lot of their products are also NSF certified. So, when you're doing drug testing and stuff like that, you want to make sure that, they're third party tested. There isn't anything, other additives that a lot of supplements have. And again, if your gut isn't in good integrity, when you're taking those supplements, you're not going to be able to absorb it. So that's the other thing. So, but yeah, definitely a multivitamin, because I have not met not one person on this planet that has all the vitamin C's and, D's and, minerals that they take from just food all day. I think we'd be just standing in front of a blender and just, drinking juice and smoothies. Like, I don't get it. But yeah, just dialing that in, making sure that you have a really good multivitamin. Vitamin D is really important. The other thing with vitamin D is, during the whole COVID time, a lot of people are like, vitamin D, vitamin D, vitamin D. And they're going, and they don't really realize that taking a lot of vitamin D when your level is so high, it actually suppresses your immune system.
That's probably good information for everybody to know.
So it's like, wait a minute, man. Having a high level of vitamin D above 100 is not good.
I think that's another conversation of, like, maybe we need to be a little bit more specific when we start making recommendations to the general public about health information, making sure that everybody's, talk to a provider, at least somebody that you trust, to analyze the levels or markers in your blood.
Yeah. Yeah. What I tend to also see really low on with a lot of athletes, and I also work with high performers, by the way. High performers meaning they're either CEOs or just executives. They have a lot of on their plate, so they have that same mindset as a pro athlete. Just they want to be on top of their game at 1%. And so what I see is that they're low in the B vitamin. So it's not ironic that a lot of my clients having to take also B vitamins and folate and B12. That's really important for when you're talking about neurocognition and neural health. B12 is very, 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 very important. A lot of the antioxidants, things like, NAC, alpha lipoic acid, glutathione, you have to be careful with that, because if you are in the middle of training, you want to make sure that you're taking those antioxidants or those things to reduce oxidative stress in a strategic manner. Because with pro athletes, we do want them to reach that level where there is oxidative stress, so they're able to make gains in their training and not blunt that response. So I see that a lot, where it's like, yeah, I'm going to do glutathione or this antioxidant or that antioxidant, taking these pills and supplements, but they've got to be careful that that's also used strategically.
What do you mean by oxidative stress?
So whenever you do train. Our cells, okay, so just to put it in layman terms, our cells create something called reactive oxygen species, right? So when we're talking about inflammation, what I'm looking at is how well is your body balancing those reactive oxygen species? Is there too much of an imbalance? Because if there is, what happens is your body is not able to mop that out. Mop it out, meaning able to metabolize that, leftover from training. And that's why people have delayed onset muscle soreness, or they have that inflammation, or they're not able to recover as well, because they have that high level of reactive oxygen species.
So when we refer to inflammation, the oxidative stress that you get from working out and things day to day can build up, and based on how your immune system handles that oxidative stress or inflammation, it'll basically dictate how you feel, how you perform, and all the things that you do on a day-to-day basis.
Bam, right there.
Perfect. Well, I feel the need to try to make sure it's all come full circle, so that way everyone understands it, because it can be difficult to navigate all these topics and different key words that people hear, because I hear it from time to time as a provider. People come to me like, well, what do you think about inflammation? I'm like, well, that's a very loaded question. Like inflammation related to what? Like, what are we talking about? So I'm glad that we're able to just at least break it down and provide at least an understanding, so people can at least come away with this understanding more about what it means.
Yeah. And that's the thing with you and I, Mike, or anybody, pro athlete, who it is, it's really about resiliency. Is our body in a state of able to get and push out all that oxidative stress? Are we able to create resiliency in our body so that way we are able to perform at the best possible way, right? And so the same thing now they're seeing with aging, right? So it's all about oxidative stress, which is why now people are starting to have these, glucose monitors on the back of their arm, right? Because they're testing for insulin resistance. Because, high levels of insulin, that's glucose, that's oxidative stress to the body. The body is having to do more than what it wants to. And so that is going to be really the key in all of this when it comes to inflammation, is how resilient is your organs? How resilient is your body to be able to get back and function the way it's supposed to be functioning?
Well, one thing you had mentioned earlier, and I waited to talk about this. You said the mitochondria, and you started saying the cell health and everything like that. And one thing I keep seeing people are doing consistently is the NAD drips and NAD supplementation. So what are some of the benefits of NAD? You mentioned that it produces more energy, and I'm curious to know, what are some of the outside things that you can see that are beneficial, or some of the benefits from NAD?
So I have not experimented with the oral supplementation. As far as with the IV, some of the benefits would be more mental clarity, more energy. Also, just you feel more rested. You feel just kind of like more alive. Those types of things. And so I think with just one drip, it's not going to make this really big difference. But that has been the biggest thing that I've heard, more so than anything else, is the more energy.
So is it a typical pattern for people to continually get NAD drips over a long period of time? Do you need to do it over a long period of time to sustain a new level of ATP production? I guess, what are you finding?
So that's interesting. So that would definitely be and I have not done this before, where it actually tests somebody's mitochondria before an NAD and then test it right after NAD. And so, and honestly, like, that's a lane that I prefer to stay away from, because again, it's one of those extra things where I'm like, that's just not really where we're about. What I'm about more is, if you really want energy, then I need to look at your gut. If you really want more energy, I need to look at your mitochondrial health. Are you missing the simple vitamins and minerals and nutrients, for that Krebs cycle to work, right?
Yep.
So it's not about the NAD. I think the NAD really is more of a Band-Aid more than anything else.
Mm-hmm.
And so if anything, I would be like, you need a multivitamin before that NAD, if that's really what the goal is. So again, there's so much hype with so much biohacking.
Mm-hmm.
So important to not get distracted and ask yourself, am I dialing in the right necessary functions that is going to make me a better athlete? Am I drinking a lot of water? Am I drinking alcohol? Am I eating processed food? Am I sleeping? So we can't just, ignore those things and be like, well, I'm just going to get an NAD drip and I'm good,
Yeah. Mm-hmm.
So that's
And
more.
it's a supplement, right? It's defined as a supplement. And what a supplement really is in addition to an already existing great diet and an already existing great thing that you're already doing. And so again, it's not to completely get rid of your multivitamin should not replace your daily intake of food. You should continue to have a good intake of food, protein, and things that you need on a daily basis. So that way you can thrive and be better.
Yeah. Do you take NAD?
I don't. No, I haven't done it yet. I've seen clinics around here who are doing the drips, and I've seen other clinicians on many social media do it as well. And I've saw that you have also posted about it. So I was curious to know what your perspective on it was.
If I were to advocate one thing, Mike, for me to just absolutely beg the NFL and NBA to do, and MLS, any pro sport, is to please, y'all, start with peptides. Do some BPC 157, like things like that. When we're talking about joint issues or things people, recovering from surgery, that kind of thing. I mean, it works wonders. I have he doesn't play right now, but he's a golfer. And, we did all the testing and I have him on this peptide and it is just completely changed his life. So not only does it help with the inflammation that was going on with his gut, because we naturally make this peptide in our gut anyways, but it's also helping him with his back pain that he's had since he was 9 years old because he's been playing golf for that long.
And what are these peptides?
Yeah. So this is something that also a lot of people have been saying, well, I can buy this online. I want to tell your audience right now, you don't want to do that. Mm-hmm. You want to make sure that you go to a good compound pharmacy that are making these peptides and you're just not buying them randomly online. And what they do, especially with the BPC 157, it's a peptide that helps with inflammation, and it gets to again, I don't want to get too sciencey with this, but it helps with really calming down that inflammation as much as possible around the site of injury.
Gotcha. And again, this doesn't replace a good diet. This only is to be a supplement to already of all the things that you're doing recovery wise and diet wise.
Right. Yeah.
Well, Maggie, this has been great. I really appreciate you coming on the podcast to share everything you've learned. We got a few more questions just to finish off everything. And this is going to be the health me to health you portion of the podcast. So I gave you a little time before with the questions. So first question is, and I ask everybody this: if you had the attention of everyone in the world for 30 seconds, what would you say?
Just be kind and not judgmental.
I think everyone needs a little bit more kindness nowadays.
I just think so. That's the first thing that came on my mind. Is just be kind. There's a lot going on, with a lot of things that are going on in our healthcare right now. And a lot of people feel that they're right and they feel that they're justified. And I think just to be kind and to be open-minded and be receptive to other people's ideas, and that you don't need to be right. Sometimes we just need to just sit back and listen, and the goal really is to just be happy and not be right all the time.
Second question: what book do you recommend, whether a book you're reading now or in the past?
So the book I've read in the past is called The One Thing. goodness, who is it by? It's Greg Papasan is one of them. I'm typing here the one thing, and this was actually recommended by my mentor before I started Elevate Performance Medicine. And it just really gave me a lot of clarity about what I wanted to do. But yeah, it's by Gary Keller. So Gary Keller, who owns Keller Williams Realty, and co-authored it with Jay Papasan. It's a really good book. And the reason why I recommend it is because just we're so distracted by so many things. And in order to be great, it's important to just focus on the one thing.
You're 100% right. Yeah. And it's really hard to do that, right? Just put all your focus on the one thing and not be like, oh, what's that over there? No, over here.
Exactly. Yeah, for sure.
Last question. Where can people learn more about what we talked about today or learn more from you?
Yeah. So I'm very active on Instagram. So you can find me at Maggie.Awad, AWAD, as in dog _. I don't know. I thought about changing it like to the gut health something.
Might as well just use your name.
So far it's my name. Also my website is elevate2perform.net. So it's elevate2perform.net, as in the number 2. And yeah, so you could DM me. I'm also on LinkedIn, very active on there with my other colleagues on there. So that's more like my professional thing. My Instagram, I like to sprinkle some things about my kids and me as a human being and what I do and my workouts and stuff like that. So yeah, so that's where you can find me.
Maggie, thank you so much for coming on the podcast today and sharing everything you know.
Thank you for having me, Mike. I appreciate you.